Hello everyone, you are watching sqadia.com and I am Hammad Haider. Today we'll be discussing mainly the pathologies around the elbow, that is the radial head fractures and elbow dislocations. In the first section we'll be discussing the radial head fractures, their pathophysiology, associated injuries, classification and how they present usually into the emergency clinics. Then we'll be also briefly discussing the imaging which we need to done to confirm our diagnosis regarding what is the type of a fracture of the radial head. In the second section, we'll moving on to the treatment and the management of the radial head fractures, both the non-operative as well as the operative. Now, in the third section, we'll be discussing that thing in more detail. That is the approaches to the radial head fractures. What is Kocher's approach? What is Kaplan approach? And how we can approach the elbow joint on a whole. Then we'll be in the fourth section discussing the fracture dislocations of the elbow, as we'll be dealing with mainly around the elbow joint today. First, we'll be discussing details of radial head fractures, their management and approaches. Then we'll be moving on to the elbow dislocations, which could be very simply dislocations, or could be a complex dislocations associated with multiple fractures. We'll be briefly touching upon the terrible triad in the elbow as well. And lastly, we'll be discussing the management of elbow dislocation, what type of it is and whether we can manage it conservatively or close reduction can be done or not, or we can have to go for an open reduction internal fixation of elbow dislocation. Thank you very much. Keep watching sqadia.com.